You've probably heard that only old men get prostate problems, or that getting up multiple times at night to the loo is just part of the natural aging process. If you have heard these stories, they are incorrect. In today's video, I want to highlight for you 5 of the most common myths that I hear in my time as a urologist over the last 20 years, and also as the director of the prostate clinic located here on the Gold Coast in Australia. Having treated thousands of men over the last 2 decades with a variety of different prostate issues, I've seen how these persistent myths with regards to prostate health can create unnecessary fear and confusion, and sometimes cause dangerous delays in men's treatment. As always, if you get benefit from the video, please give it a thumbs up, subscribe, share the video with others that you think may get benefit from it also. Okay, myth number 1. A high PSA always means prostate cancer. If nothing else, this myth causes the greatest degree of panic that I see in my clinic on a regular basis. In essence, the PSA test is something we do to screen for prostate cancer. However, not everyone who has a high PSA has prostate cancer. In fact, just last month, I saw a gentleman who came to me from his GP. He was absolutely petrified with regards to his risk of having prostate cancer. His GP told him his PSA was 6.2. A normal PSA for men in their 60s is less than 3, and most men have a PSA of 1.2. He was convinced already that he had cancer and was plotting already his treatment that he would require. Here's the reality. For many men, an elevated PSA can be a byproduct of nothing to do with prostate cancer. One of the challenges we have with interpreting PSA values is that as the prostate grows, or if the prostate becomes irritated or inflamed, it can push the PSA up. In fact, a significant proportion of men who do have a high PSA actually don't have prostate cancer at all. So it's really important that if you have a PSA test, number 1, let's repeat it to determine if it is persistently elevated. And if it is, the next step is an MRI scan to get a picture of your prostate to see exactly where your prostate cancer risk lies. Please don't jump ahead. The PSA test is really there just to give us a guide. It in and of itself is not diagnostic. Myth number 2, prostate problems are just normal aging. Now, it's interesting that this myth, in my opinion, is the thing that keeps men suffering in silence, or perhaps not silence, but suffering for many years unnecessarily. Yes, it's true that as you get older, your prostate will grow, and it does mean that many men, as they progress through life, develop urinary symptoms. But you don't have to accept a poor quality of life related to an enlarged prostate. Recently, I saw a man in his late 60s who was getting up multiple times at night to pee, 4, 5, sometimes 6 times at night to pee. His wife was sleeping in a separate bedroom because she was too disturbed with the multiple trips to the toilet in the evening. Now, asked why he hadn't come sooner, the gentleman replied to me that he just thought that this was something that happened as men got older, and he expected that he had to live with it. Here's what's not normal. If you struggle to pee, if you have hesitancy getting started, and if your stream is very weak and it takes you a long time to pee, and sometimes you feel like you haven't emptied properly, this is not normal. If you're getting up more than twice per night, again, this is not normal. The concern is that if left untreated and men do have complications from an enlarged prostate, it can lead to things such as infections in the bladder, developing stones in the bladder, or worse still, back pressure up to the kidneys and potential kidney damage. The great news is you don't have to suffer in silence, and there are excellent treatments that range from medications through to minimally invasive treatments such as steam or Urolift or iTind, all the way through to definitive treatments such as a green light laser prostatectomy that can provide significant benefit to men in terms of improving flow and reducing the frequency that men need to go to the toilet. If you experience any of these things, have a chat to your local doctor. Be aware of what your choices are, but you don't need to suffer in silence. Myth number 3. All prostate surgery causes permanent impotence. Impotence obviously is the inability to achieve and maintain an erection sufficient for penetrative intercourse. Now, for many men, this is a key myth which causes men some delay in coming forward for testing or screening for prostate cancer. Being able to bust this myth really has the benefit of potentially increasing men's survival and reducing the probability of passing away from prostate cancer. Now, let's be clear about one thing. The way that we do surgery now, compared to how it was done over the last 20 or 30 years, is significantly improved. Historically, it would be an open operation. Now, almost all of the time, it's with robotic keyhole surgery. And depending upon your disease profile, what's the Gleason score? Can your cancer be felt? Whereabouts in the prostate is a man's cancer? And also in combination with pre-surgical erectile function. If men are less than 65 without diabetes, without high blood pressure, they've got good erections, and we can spare both the nerves to the penis, men actually have a high probability of recovering erectile function. Now, admittedly, it can be the slowest functional aspect to return after surgery, but there is a high probability of recovery within 12 to 18 months as long as men meet certain criteria. Don't expect to recover erections after surgery if a man has diabetes and poor erections before surgery, and also the cancer profile precludes bilateral nerve-sparing surgery. One of the more common stories that I hear when I'm talking to men in the clinic is that when we're talking about priorities following any prostate cancer treatment, they prioritize, particularly young men, for obvious reasons, but they prioritize sexual function over cancer cure or continent recovery. To give you an idea of how profound this desire is to maintain or recover erectile function following surgery. Please, if you find yourself in this category, if you've been through this journey, please, if you've got a comment, share it in the comment section down below so other men may learn from your experience. Myth number 4 is that supplements can cure prostate cancer. Now, the supplement industry, when we're looking at men's health, globally is a multi-billion-dollar industry. They're great at marketing. Many men don't like, for example, having prescription medication. They don't like the idea of invasive treatments, and they elect to pursue things from a supplement perspective. Now, to give you an idea, saw palmetto is the most extensively researched supplement when it comes to managing urinary issues related to an enlarged prostate. Multiple large population studies have actually shown that it's no better than a placebo. That being said, it's true for many other herbal remedies. Despite that, I see regularly, at least every week, multiple people coming into the clinic that have been on some form of herbal extract to try and improve their urinary function, sometimes for several years before they present for assessment when it comes to their prostate health. If you do want to support naturally your prostate health, which I advise every man that I see in the clinic to do, there are certain lifestyle modifications that are pretty easy to commence. Have a heart-healthy diet. Avoid processed food. And the cornerstone of what I say to men is if it comes in a packet, please avoid it. Have plenty of fruits and vegetables. Reduce your consumption of processed meat. Be mindful of the amount of red meat that you consume, certainly on a daily or weekly basis. We should all be exercising more days than we don't. We should be lifting weights or performing resistive exercise as we progress through life, trying to prevent sarcopenia or wasting muscle loss. These factors will be far more beneficial to us for our overall health as well as our specific prostate health. And the final myth number 5, is that only men over the age of 65 need to worry about prostate cancer. And this is a really dangerous assumption. Now, You may be aware that 1 in 7 men have a lifetime risk of developing prostate cancer, and if there is a family history, that risk will be increased. Now, although the majority of men that I diagnose with prostate cancer are in their mid-60s, I do see men in their 50s and every now and again men in their 40s that do have prostate cancer. Certainly, if you have a family history of prostate cancer or breast cancer, or the BRCA or the BRCA2 gene is prevalent in your family, you do need to consider having prostate cancer testing at an earlier age. Here in Australia, the current guidelines are if you're a man of average risk, have a PSA test when you're 50. There is a push to bringing that forward into your 40s where you're less likely to have BPH or the benign enlargement to your prostate, and your PSA when you're in your 40s can give a far more accurate lifetime prediction of your future risk of developing significant prostate cancer. If you're unsure of where your risk is, please talk to your local doctor, have a discussion about having a PSA test so that you can be better informed with regards to your risk and you can make choices that you think are appropriate for you. As always, if you have a comment, please leave it in the section down below. Subscribe, share. Until the next time, take care of your prostate.